Congestive heart failure occurs when the heart does not properly pump enough blood to the rest of the body. Symptoms include fatigue, shortness of breath, and edema. Treatments include fluid regulation, weight maintenance, exercise, and medication therapies. Risk factors include hypertension, high cholesterol, smoking, and diabetes. It affects 20 million people worldwide, and 1 in 5 people are at risk over their lifetime. Ventricular fibrillation, or VFib, is considered the most serious cardiac rhythm disturbance. Disordered electrical activity causes the heart's lower chambers, the ventricles, to quiver or fibrillate instead of contracting and beating normally. This prohibits the heart from pumping blood, causing collapse and cardiac arrest. This type of arrhythmia is a medical emergency and life-threatening.
Hi, my name is Bill. I have had history of congestive heart failure, strokes, and ventricular fibrillation, or VFib, as the doctors like to say. It is a life-threatening heart rhythm that results in a rapid, inadequate heartbeat. I also have high triglycerides. I like to eat ice cream. I went into the ER complaining of chest pains and vertigo, and was admitted immediately because my EKG showed heart function at 10%. Due to my low functionality, I needed immediate surgery. The doctor said I would not survive bypass, so I needed open heart surgery. They said I needed a defibrillator pacemaker implantable cardiac device. I came through surgery with flying colors and was prescribed lidocaine, which is a class 1 drug used to treat ventricular tachycardias. Ventricular tachycardia is a type of irregular, fast heart rate arrhythmia that arises from improper electrical activity in the ventricles of the heart.
Lidocaine alters signal conduction in neurons by prolonging the inactivation of the fast voltage-gated sodium channels in the neuronal cell membrane responsible for action potential propagation. With sufficient blockage, the voltage-gated sodium channels will not open and an action potential will not be generated. Careful titration allows for a high degree of selectivity in the blockage of sensory neurons, whereas higher concentrations also affect other types of neurons. This pathway, the action pathway of lidocaine, illustrates the targets involved in antiarrhythmic therapy. Contractile activity of cardiac myocytes occurs through action potentials which are mediated by a number of ion channel proteins. During rest or diastole, cells maintain a negative membrane potential. Membrane ion pumps, such as the sodium-potassium ATPase and sodium-calcium exchanger, maintain low intracellular sodium and calcium concentrations and high intracellular potassium concentrations. The positive outflow of potassium ions helps maintain the negative intracellular electric potential. When cells reach a critical threshold potential, voltage-gated sodium channels open and there is a rapid influx of positive sodium ions which travel down their electrochemical gradient. This is known as the rapid depolarization or upstroke phase of the cardiac action potential. Sodium channels then close rapidly and activate potassium channels.
During the next phase, known as the plateau phase, calcium L-type channels open and the resulting influx of calcium ions roughly balances the outward flow of potassium channels. During the final repolarization phase, the voltage-gated rapid channels and slow potassium channels open, increasing the outflow of potassium ions and repolarizing the cell.
Lidocaine's major protein targets include sodium channel proteins alpha type 5, 9, and 10, which assume open or closed conformations in response to the voltage difference across the membrane. Alpha 10 is a tetrodotoxin-resistant channel that mediates the voltage-dependent sodium ion permeability of excitable membranes. The protein forms a sodium-selective channel through which sodium ions may pass in accordance with their electrochemical gradient.
Alpha 9 mediates the voltage-dependent sodium ion permeability of excitable membranes. The protein forms a sodium-selective channel through which sodium ions may pass in accordance with their electrochemical gradient. It is a tetrodotoxin-sensitive sodium channel isoform. Alpha 5 is very similar to alpha 9's function, except this channel is responsible for the initial upstroke of the action potential. Channel inactivation is regulated by intracellular calcium levels.
Lidocaine mainly interacts with the enzyme group cytochrome P450, shown as the green lines in the figure. These are a group of heme thiolate monooxygenases. In liver microsomes, this enzyme is involved in an NADPH-dependent electron transport pathway. It performs a variety of oxidation reactions of structurally unrelated compounds, including steroids, fatty acids, and xenobiotics. Cytochrome P450 acts as a 1,8-sinyl 2-exomonooxygenase. The enzyme also hydroxylates etoposide and catalyzes 4-beta-hydroxylation of cholesterol. It is responsible for the metabolism of many drugs and environmental chemicals that it oxidizes. It is involved in the metabolism of drugs such as antiarrhythmics, like lidocaine.
This compound belongs to the class of organic compounds known as M-xylenes. They are aromatic compounds that contain an M-xylene moiety, which is a monocyclic benzene carrying exactly 2 methyl groups at the 1 and 3 positions.
Lidocaine is about 95% metabolized in the liver, mainly by cytochrome P450 to the pharmacologically active metabolites monoethylglycine xylidide, and then subsequently to the inactive glycine xylidide. MEG-X has a longer half-life than lidocaine, but also is a less potent sodium channel blocker. About 60% to 80% circulates bound to the protein alpha-1 acid glycoprotein. Up to 20 to 40% of patients will experience inappropriate shocks from their ICD. These shocks can severely reduce quality of life. Patients describe shocks as being kicked by a mule, and they can lead to increased anxiety. The first step in preventing inappropriate shocks is to treat the underlying cause.
Medications, metabolic abnormalities, and ischemic events are underlying causes of shock. Drugs that increase the defibrillation threshold can cause defibrillation to fail, and a higher voltage shock would be delivered from the device for the second shock. A month after his surgery, his heartbeat was much higher than normal function. Even though lidocaine is used as an antiarrhythmic medication, it can actually cause tachycardia in the wrong dose. For Bill, due to his incorrect dosage of lidocaine, it increased the defibrillator threshold. The defibrillator threshold is the lowest amount of energy required to successfully defibrillate the heart and restore sinus rhythm.
To fix this issue, my lidocaine doses were adjusted carefully according to my individual requirements. I have constant EKG monitoring, and my heart function is up to 30%. From 10 to 30% doesn't seem like much, but that's a major increase in functionality.